Yeah, hi, good morning, everyone. It's a Sunday morning. We are live on Facebook and YouTube. Today, we are covering a very important topic of medical negligence. Over a period of time, we have seen in the last 2 years, and even before that, uh, there has been a lot of issues in the medical industry, and there has been always a dispute between a patient and a doctor's relationship, which has been questioned. And nobody is, like Dr. KK used to say, nobody is wrong, everybody is correct. And if the person is not correct, he is different. So during this time, the pandemic has really taught us how to be different. The medical industry is going for a change. IT revolution has come in. So we are discussing about medical negligence, part 2. And this is a DMA NDB doctors meet. We will have Advocate Ira Gupta. She will be presenting the topic, and then we will open the forum for the question answers. Ira Gupta has been in practice since 2010 and has been working with Dr. KK for very, very long. She has filed multiple PILs on records with Dr. KK, and she has also been a practicing lawyer registered under the Bar Council of India. She has her own law firm, Privy Law Firm, and she has appeared in front of Supreme Court, High Court, and all the district courts. She takes all kind of cases, and she has a specialty on medical law. Over to you, Ira.
Thank you so much, Saurabh. Thank you for your kind words. The topic that we have today is medical negligence, and we have already covered one part 2 months back. So before starting it, I want to know people sitting over here that do they remember what we studied about medical negligence, what we discussed about it 2 months back? Does anybody can tell me what exactly medical negligence mean?
Yeah, and let's make this session a little more interactive. So anybody who wants to say anything on this topic, even if they don't remember, or even if they were not a part of that particular day, anybody who wants to talk about this topic before we can start formally?
If there's anybody who want to say something about this, what exactly, because I can see everybody over here is a doctor, so they obviously know about little bit about what is medical negligence, what is medical law. Is somebody?
There is.
I think this Galaxy J7 want to say something.
Yes, sir. Tell me. So Dr. Sanjeev says, could you please review the last lecture, some bullet points, what we have covered?
Yeah, so what I have in my, going forward with my presentation, I have covered what we discussed last time, plus I have covered the new topics also. So my presentation before starting it, just to give an overview about it, it will cover the definition and the meaning of medical negligence. And because people over here sitting are mostly doctors, so from the doctor's point of view, what are the important things they should remember? And if in case any medical negligence come forward before them, then what are the different type of defenses and what are the important points they need to understand and they need to cover it up in their defense is being covered in the presentation. So I'll just share my screen. Is my screen visible?
Yes, Ira, it is.
Okay, let me just. Is it full screen is visible now?
No, not yet. Just need to press the presentation mode.
I have pressed.
Yeah, okay.
Is it? Yeah. So first, let us, this is what we discussed last time also. So I'm just covering a few slides, which we have discussed last time also. The most important thing to understand why we are discussing this medical negligence topic. What is the importance of medical LEGO? So the reality of discussing this topic before this forum is because of large number of cases which are coming up against the doctors and the hospitals. And the main reason of why after such a long time now the doctors are facing so many cases against them is because of the compensation which are being awarded in the medical negligence cases. So there are few cases in which more than 1 crore has been awarded to the patient or his family against the doctors and the hospital including. So this is the main reason now why the people are coming forward and filing the cases, and the doctors are being forced to understand the medical negligence law. What is the medical negligence and what is the medical legal part? What is the law they need to understand? Just a minute. Yeah. So let us, before understanding what is medical negligence, first, medical word, everybody over here knows better than me. What does the medical word means? So what is negligence? It is important to know what is negligence, because not everything is negligence. So negligence is only that part of which there is a breach of any duty, what you were supposed to do or what you that you have not done, or what you were not supposed to do and you have done. That is what is the negligence. So negligence, I will say, are basically three important points of negligence. There is one is the legal duty to exercise due care. So in case of a doctor-patient relationship, as it is an emotional relationship, it is very important for a doctor or the that to understand that whatever he is doing it proper due care, because there is a legal duty he has to exercise due care. He need to understand the standard of care. What is are the reasonable standards of care he has to take care while treating the patient or even while prescribing any medicine to a patient, and during the surgery also. There should not be any, if there is a breach of that duty, that you have done something which you were not supposed to do, or you have not done something that you were supposed to do it, then there is a breach of duty. And that because of that breach of duty, there is some damage or injury caused to the patient. Then that includes medical negligence. That is the negligence part. So there are three important things. One is the duty, second is the breach of duty, and third is the damage. What is medical negligence? And there, medical negligence means if there is a doctor patient relationship and the doctor does not take proper due care and there is a breach of his duty, and because of that the patient suffers some damage or injury, then it is a medical negligence. So there are certain medical negligence include certain constituents, like the doctor should have a legal duty, and there is a failure to perform the patient properly, treat the patient properly, the patient suffers some risk, some damage, some injury, or there is some treatment, it does not go in the right way, or surgery does not go in the right way, the dis and most importantly, if the risk has not been disclosed. So there is a concept called communication and informed communication. The doctor is before treating the patient, the doctor is supposed to tell the patient about the treatment protocol. What is the treatment protocol? What are the various medicines he will prescribe to the patient? What are the risk involved in the treatment and the surgery, or the if the particular medicine, what kind of particular medicine, whether it causes any injury or not. So if the patient doctor has informed the patient about all these risks and then the patient has given consent, then they you can say medical negligence is not a part, because that is something which is a part of your treatment. And because of this breach of duty, there is an actionable claim against the doctor, then it all constitute medical negligence. So to understand medical negligence, the most important thing which is one, the treatment which you are giving to the patient, it should be in a as per the standards of care. It should be within the reasonable standards. You should tell the patient about the risk involved, the side effects of any medicine, and if still the patient suffers any problem and he files any case, then it is a medical negligence. Not all medical negligence are actionable claims. So sometimes there are cases where doctor has taken proper reasonable care, he has performed the treatment, he has given the surgery according to his degree and knowledge, and still the patient has suffered injury because of some unforeseeable reason, then those errors cannot be medical negligence. The actionable medical negligence will be only when the doctor does not has not taken proper reasonable care of the patient, he has not performed according to his degree and knowledge, he has not performed according to the ordinary skill which any other doctor should have performed, and then the patient has suffered to some injury, then it is an actionable medical negligence. So gross medical negligence is the negligence which is actionable. Not all type of medical errors are actionable. Medical errors can be like आपने कोई medicine दी and so because of that medicine there is some side effect to the patient, and which side effect you have already informed the patient or his family or the person uh, taking care of the patient, then it cannot be a medical negligence, because that risk was already foreseen and that risk has already been informed to the patient, and after knowing and understanding the risk involved, the patient has given consent to the doctor for the treatment. So that part of medical error will not be a medical negligence. There are still some responsibilities of the doctors, and because of those responsibilities only these medical negligence cases are being filed and against the doctors. So some responsibilities of the doctors are, most importantly, one is to continue to treat the patient even if the patient, there are certain circumstances when the doctor cannot do it. Doctor has to take reasonable care of his patient. The doctor has to exhibit reasonable skill, he has to perform the treatment and perform the surgery according to the reasonable skill and standards of medical protocols. He cannot undertake any procedure beyond his control. So it should not happen that a orthopedician doctor is treating the ENT patient. So the doctor should perform only according to his qualification, special training and experience. If the doctor goes beyond his qualification, training and experience, then yes, it is a actionable medical negligence case. So we have discussed about what is medical negligence, what are actionable medical negligence, and the responsibilities of doctors. Now I want to tell you, going forward, we will discuss about the various instances when medical negligence is not the case, and doctors can take that as a defense if in case any case is filed against them. Like there cannot be 100% guarantee given by the doctor to the patient. The whatever I am discussing over here is has been settled law and has been passed in the judgments by Honorable Supreme Court of India and Honorable National Consumer Commission. So this is not something which I have written or I'm saying only on my own. This is what the settled law is. So there cannot be 100% guarantee. No doctor can give 100% guarantee of any treatment or the surgery. And simply because any treatment has gone wrong or surgery has failed, the doctor cannot be straight away be liable for medical negligence. What has to be proved by the doctor that while treating, he possessed the specific knowledge, he had the specific degree, he had the specific training, he had the specific experience of treating that patient, and he has done that treatment a number of times. The treatment protocol that he has adopted is according to the reasonable standards of care, is according what any other prudent doctor would have done. So if the doctor is doing everything according to his medical law, medical literature, according to his qualification, and still the treatment does not go well, that does not mean that doctor is liable for medical negligence, because no surgery, no treatment is 100% correct. Human body changes. Every person has got a one particular type of problem. Every human body is different from each other, so they cannot be one plus one equal to two is not something in medical thing. So there is no 100% guarantee. The most important thing, like before also I said, standard of care. Standard of care is the most and the basis of any medical thing. So to come out of any case, it is very important for a doctor to prove that he had a reasonable degree of skill and knowledge. He had a proper qualification, training, and uh, training and expertise. He had conducted this type of treatment number of times. He is a reasonable, prudent doctor, and whatever treatment he has given according to the medical procedure only, standard of protocols that are available, guidelines which have been practiced by other prudent doctor. If any doctor is not able to prove standard of care, if any doctor is not able to prove reasonable degree of skill and knowledge he possesses, then yes, the doctor can be liable for a medical negligence case. So the normally the question comes before me is how to prove standard of care, how to prove that we have a reasonable degree. So it is very simple. You need to, when if a case comes forward and you have a case, then you need to file your medical degrees. If your resume, your profile is running into number of pages, don't worry about it. Don't worry about the number of pages. File it. You have published, you have done researches, show it to the court. You have done researches. If you have conducted number of cases, prove and tell the court, yes, I have done hundreds of cases, thousands of cases, and this is the what the all the cases, this is the same kind of procedure I have followed. So to prove standard of care, it is very simple for a doctor. You file your profile, you file everything, give details of all your publications, researches, whatever you have done. Tell the court about it, because that is the only way to prove standard of care. File all your degrees as well, whether it is a diploma, it is a certificate course, or the CMEs that you conduct and you get certificate of it. File it before the court, because that's only the way to prove it, that standard of care. Different diagnosis or treatment. So different diagnosis and the treatment which have been adopted by the doctor cannot be a reason for medical negligence. So they can be for treating one particular problem, they can be n number of treatment protocols, they can be n number of different diagnoses. So just because of the reason the doctor has adopted one particular type of diagnosis or the treatment procedure does not mean that the doctor is liable for the medical negligence. If a doctor proves that yes, there are more than one treatment protocol, there are more than one way of getting the treatment done, there are more than one way of diagnosis, and the whatever the course of action, whatever the course of treatment he has adopted is according to is reasonable and is adopted by the medical procedure, is adopted in the medical literature, and is being practiced by other doctors also, then just because of the reason he has adopted one particular medical diagnosed treatment does not mean that he is liable for medical negligence. So just different diagnosis and different treatment procedures does not mean that every doctor is liable for medical negligence. Accident or complication. Many a times the cases come where the accident is there and the doctor has to do what is right and what is wrong. So in case of an accident or in case of any complicated case, if the doctor do something right according to his reasonable degree and skill and according to his qualification and experience and training, and even then if anything goes wrong and the medical procedure is not correct, then such accident or complications cannot be described as medical negligence, because whatever the doctor has done, he has done to the best of his knowledge, to the best of his qualification, to the because every doctor's perspective is to take care of the patient. But even in cases of complications and even in cases of accident, it is important for the doctor that he takes an informed consent. He communicates to the family of the patient or the patient himself, if the patient is in sound mind, or the person who is taking care of the patient, about the procedure, about the complications that can occur, about the accidents that can occur during the treatment also. So it is important that the doctor gives an informed consent, and it just should not be only an informed consent on a piece of paper. It should be a proper informed communication, I will say. So the informed communication means you sit down with the patient, you sit down with the family member, you sit down with the person taking care of the patient and make them understand what is the medical procedure, what are the complications that can occur, what are the accidents that can occur, and what are the side effects that can occur, and then you go ahead with your treatment procedure. In case of emergency or unexpected happening, just like accidents or complications, and sometimes there is an emergency case of a patient, and the doctor, according to his reasonable degree and knowledge, if he exercises some medical procedure and still that same goes wrong, then also the doctor cannot be held liable. But at the same time, whatever situations I'm discussing over here is the bottom line of every defense for a doctor is that he has to prove that he has a reasonable degree of skill and knowledge. Whatever procedure he has adopted is a reasonable procedure, is a procedure which is adopted by the medical field, and at the same time he has, whatever he has done, he has informed the patient and his family member about the procedure and the other risk involved. The doctor no doubt has a discretion in choosing the treatment which he proposes to give to the, and such discretion is relatively ampler in cases of emergency. So doctor has a right to choose a treatment procedure, but at the same time, that does not mean that the doctor chooses some treatment of which he does not have any knowledge or skill. There can be a difference of opinion while treating the patient. There can be some error of judgments while giving the treatment procedure, but at the same time, if there is because of some error of judgment or difference of opinion, the procedure goes wrong, the patient is not well, or patient suffers from any kind of injury or damage that does not amount to medical negligence. If the doctor is able to prove that he has a standard of knowledge and the reasonable care has been taken care by him. So for every kind, just because of the reasons he has there is some error happened or some difference of opinion is there, or one doctor says this is not right, the patient goes to the other doctor and the other doctor says this is right. Just because there is a difference of opinion and just because they two different doctors are giving different opinion on their medical procedure does not mean the doctor is wrong. One important thing that doctors should take into consideration is that medicines, whichever they are prescribing, whichever they are administrating, it is given as per the instructions which are mentioned in the packages. Many a times I've seen that the doctors give them doses beyond the maximum doses which are prescribed on the packages. So the doctor should know how much the medicine should be given. The dosage should be according to the what is mentioned on the package, and the doctor should follow all the instructions on the package of the medicine, and they should know what kind of medicine they are prescribing, whether how much dose is important for the patient and how much dose is actually mentioned maximum dose on the package. The similar thing goes for the medical equipment also. The doctor should, while using any kind of medical equipment, they should follow proper instructions. If they are not able to follow proper instructions as mentioned on the package of a medicine or on any medical equipment, and they have prescribed any medicine of a dosage which is beyond the maximum dosage, then yes, doctor can be held liable for the medical negligence in that case, if the medicine does not work for the patient. Thank you. So this was a very short I have made. This is a very long topic, but briefly I have covered the important topics and the important defenses which a doctor can take while defending him in case of any medical negligence cases filed against him. I will say the two main important things every doctor should understand while fighting any case is: one, he has to prove his medical degree. He has to prove he has a proper knowledge about the treatment he has followed. He has to prove that he has a proper expertise in that treatment. Second is, before treating the patient, you need to have a proper informed consent, not just consent, informed communication. Communication is very important part. If a doctor is able to prove that he informed the patient about the injuries that the patient can suffer, about the damages that the patient can suffer, about the side effects the patient can suffer, then yes, I'm telling you, every doctor can be safe. The third most important thing every doctor should follow is they should not get panicked. If they face any case against them, they should not get panicked. What you should do is take your medical records of that patient to some other doctor who is an expert in your field. Take their opinion, take their independent opinion, and if there is a case against you, file that opinion also along with your case. If you have an expert opinion, if you have an opinion of one or two, I will say only one expert opinion will also help you. If you have an expert opinion of that problem, then yes, you can come out of any kind of case. Before starting this discussion, somebody asked me about medical certificates. Yes, the doctor should not give any fake medical certificates. If you are giving any fake medical certificates to any patient, then you can be held liable for the same. It is a criminal offense. Giving a false document, that to a medical certificate, is a criminal offense. So you should not do it. You should avoid doing it. The doctor should give certificate only to their treating patient, only to the patients whom they are treating, and only for the problem that they are actually treating. It should not be just for some money, and sometimes many times the patient comes कि नहीं नहीं डॉक्टर साहब आप ऐसे ही दे दो, कोई बात नहीं, कुछ नहीं होता, नहीं, ऐसा नहीं है. It does make you held liable for the same. So I think, Saurav, we can open the floor for the question and answers.
Yeah, we have a lot of questions coming up from the Facebook as well. But before, and anybody who is watching on Facebook or YouTube would like to join this session can come on Zoom. The meeting ID is 841-4731-1677, and you can have questions asked directly before. And after that, anybody on the floor has a question before we can take it? Okay, Dr. Wadhwa, please.
Thanks a lot for this enlightening lecture. We do come across instances or situations when we realize that it is an emergency, we explain to the patient, but the informed consent for surgery is not given by the patient or the relations. What is the, how does one go about such situations?
In case of emergency, yes, the doctor has the right to take the decision about the treatment, about the surgery. In case of emergency, yes, the doctor has the right, even if the doctor has not been able to get the confirmed consent sign or informed communication. So that does not mean just because every doctor in emergency situation is trying to save the patient only. Whatever procedure you adopt is only for the benefit of the patient. Yes, in some situation, the patient does not respond to that treatment or to that surgery, but that automatically does not mean that the doctor is liable for medical negligence. And just to give you one more thing, one tip, whenever you take any informed consent, take a thumbprint of a patient or the relative, whoever is giving the whoever is signing the informed consent for, because there is a judgment of Honorable Delhi High Court in which they have the patient came forward before the court saying that we have not signed the informed consent form. But what was happened in that case was the relatives of the patient had marked the thumb impressions, and the judgment clearly said signatures can be forged, but the thumb impressions cannot be forged. So if you say that I have not signed these are not my signatures, yes, that can be a disputed question. That can be a tribal question, whether you have signed it or not, whether the signatures are forged or not. But in case of thumb impressions or in case of finger impression, that cannot be a situation. Every thumb is a different. Every human being has got its own thumb.
Similarly, communication is as important, and documentation is also very important. But
Correct,
in some situations, when the emergency demands that treatment takes precedence over, documentation, communication, of course, will definitely, verbal will be there. But if it is not documented or the documentation is not proper and one has to proceed with the emergency treatment, then what is the liability on that?
So that's what I said. In case of emergency, it is allowed. Not all kind of emergency cases which fails are actionable medical negligence. No, sir. So you can take an example of COVID. We have seen in second wave how the situation was. Every doctor was trying to perform according to his best knowledge. Every hospital was trying to perform according to his best knowledge and best treatment they were giving. But yes, we have seen, unfortunately, that all the procedures are not going well. But no, I don't see that every doctor is liable for it. Whatever they have done according. COVID is a very good example of this emergency situation. No doctor has got a perfect knowledge of how this disease has come, how this pandemic has risen so much that since last 2 years we are in still a lockdown situation. So this is an emergency situation only. All the procedures which is like a hit or trial, we don't know what exactly the right dose, what exactly the right medicine to give to be administered to any patient. This is an emergency situation.
Have there been any cases related to COVID management? I mean, in the last 1.5 years?
Honestly, sir, abhi right now we have not seen. Yes, there have been some people, to be honest, some people have been thinking of filing some cases. But the problem is, especially in COVID, all the doctors are safeguarded by the government, very according by the law, very clearly. So no actions can be taken, because if you have followed the advisory of the Ministry of Health and if you have followed the advisory of all the governments, then yes, there is no medical negligence. If you have not followed that, then maybe. But at the same time, COVID is a situation which everybody knows has got no proper procedure and standard of treatment.
So, Ira, there's a question.
I also have a question. I'm Dr. Kiran.
Yes, ma'am.
Suppose I treat a patient for some infection, like in lungs or gynae, and after 6 months, patient dies of cancer in some hospital, and patient, says that no cancer was there that time also, but doctor couldn't diagnose. So what it is, and the patient keeps fighting, and patient is being tutored by many doctors, and then he's making money.
Ma'am, you have a very specific question, and it relates to a specific case of yours. So, without reading your documents, I can't say.
I think Ira, let me ask this question in a very general form.
Yeah, just a minute, sir. But at the same time, ma'am, just because of the you have, can I know your field of expertise, ma'am?
No, I'm just discussing a case. It
so
is there in the...
if it's a lung, suppose for example it's a lung infection and the patient is a cancer patient, he gets the cancer.
So patient was treated for tuberculosis by a specialist, specialists of lungs only, but yes, the patient died of carcinoma lung after 6 months. So he says that he was given anti-tubercular treatment unnecessarily.
No, ma'am. Then at the same time, you have to show whatever treatment you have given is according to the reasonable standard. Yes. It's not something which is you have not given some treatment or some medicines which are not according to the medical protocol.
Yes, but the case is getting prolonged unnecessarily because patient is being tutored. वो कुछ ना कुछ point निकाल लेता है फालतू का.
So, ma'am, उसके लिए like
lawyer should understand. The doctor is saying he should read the valid points, and then I don't know. It is just getting prolonged unnecessarily. 10 साल हो गए. 10 years से चल रहा है.
I understand what you are saying, but the problem in judicial is here. We follow the principles of natural justice, and one of the principle of natural justice is opportunity of being heard. Opportunity of being heard का meaning simple है कि आपको जब तक patient अच्छे से trial नहीं होगा, उसका decision नहीं आएगा. So वो होना ही पड़ेगा. And I agree, it is a lengthy process. It takes time, but then we can't do anything about it. You have a problem, you can file an early hearing application. आप जाइए file करिए. You will get the relief as quickly as possible. Or to prove your case कि आपने medical procedure according to the medical protocol follow किया है, it's very simple. You can file your profile, you file your medical literatures about it. चाहे जितने भी medical literatures हैं, medical researches हैं on that particular type of treatment, file it. Don't hesitate. Many a times I've seen doctors saying कि नहीं इतना सारा इतना मोटा हो जाएगा, बहुत paper copy photocopy खर्च हो जाएगा. Let it be. File it. चाहे वो it goes into thousands of pages, it's okay. Take an expert opinion at your independent level. File that expert opinion also.
Okay, thank you.
We have a couple of questions. One, I think there's a question which is very common over here, what Dr. Sanjeev has asked and what is on the Facebook.
Yeah.
Doctors have done all their due diligence and everything what they have to do as per the protocol, but there has been a negligence from the side of the hospital, and it is very difficult to prove sometimes what is a negligence, because hospital doctor is a face, management is not the face. It is usually the doctor which is interacting, but a lot of times the hospital is at the ownership. And this is the question which came from Facebook, but Dr. Sanjeev is asking, what is the difference between the medical negligence of a doctor and a hospital if the patient is not admitted due to the lack of bed, as we have seen in the COVID era? So would you like to answer both the questions at the same level, same time?
Yeah, so they both are overlapping questions. Medical negligence of a doctor is different from the deficiency of service by the hospital. So medical negligence can be attributed to a doctor only if something goes wrong in the treatment procedure, only if the treatment which the doctor has given is not according to these medical standards or is not according to his reasonable degree of skill. So standard of care, which is the bottom line of medical law, is which the doctor has to prove. If because of a hospital management's problem, the hospital has not been has not been able to provide any bed, or hospital has not been able to provide any meal to the patient on time, or hospital has not been able to keep the hospital clean and tidy, and sanitization is not there proper. So all these are not a medical negligence, all these are deficiency in services on the part of the hospital. So yes, the patient will, because for the patient, doctor is the hospital, doctor is the face of the hospital, doctor is the one who is treating the patient. Patient does not know who is the hospital and who is the management of the hospital or who is the owner of the hospital. So whenever they file cases against the doctor also. But then yes, because case has been filed, you have to fight it, and you have to prove that this is a deficiency of service on the part of the hospital and not the doctor. Doctor is and it's not a very difficult thing to prove on the simple difference between the deficiency of service and medical negligence of the doctor, because doctor can easily show he is just a treating doctor. He does not have any right in the administration. He does not have any say in the administration.
When such cases are filed, is that a right of a doctor to counterfile or something, like, inform that this is a case which is meant for the hospital and not for me because this is a negligence? Yes. Because there's a lawyer fees. A doctor cannot just go and fight the legal cases, because it could be a legal thing for the hospital. And for a hospital, it is much easier to fight a legal case than for just a doctor.
See, many times it has this also happens, that the patient files only case against the doctor, and when in fact it is the deficiency of service of the hospital. So yes, in that case itself, the doctor can file an application and make the hospital party to it. You have rightly said, fighting a case is a little expensive affair for the doctor. So for that, you can, nowadays the government is advertising and is promoting mediation, so you can always refer your case for mediation and ask the court to mediate your matter, or ask the patient to mediate it. In fact, in every hospital, I will suggest that every hospital should have a grievance forum where the patient is forced to first file their complaint before that grievance forum, and that grievance forum should try to address the complaint and should try to resolve the complaint. And then if that is not being able to do, then they can take whatever legal action they want to take against whoever they want to take. But yes, if any case has been filed, you have to fight it, and you should fight it.
No, but it's very difficult for a single doctor to fight against the institution. Doctor has to go with the institution. No, it's not about the fighting against the institution. We cannot go against the hospital. We cannot say that the problem was with the hospital and it was not with the doctor. We cannot say that.
I agree with you. You cannot say outrightly that. But then at the same time, then how will you say? You just mention in your defense, then you have to mention in your defense that it was not a medical negligence.
We can say that it was not medical negligence on part of the doctor, but we cannot say such and such deficiency was there in the hospital, where we are working. So we are going against the hospital, then we lose the case.
No, I agree with you. But sometimes in some situations, if it has to be done, then you have to make a party to them.
I think it all depends on how severe the case is, and
Exactly.
if it's not something which can cost you a license or something like that, then I think it makes more sense for being a joint. But if it costs you, a lot of things, then I think it's worthwhile to include the hospital as a party. It's just my suggestion.
Madam,
OPD and non-COVID admissions were refused due to the COVID protocol in recent past. That has hurt the regular medical care. Is that also negligence?
It can be and it cannot be, because in some cases have been filed before the Supreme Court. Also, there was a PIL, and where OPD and non-OPD admissions were refused and the patients suffered some problems. But because in COVID situation, the government has come out with the safeguard to the doctors, and at the same time, some state governments also force the doctors to open their OPDs irrespective of the lockdown, irrespective of the COVID. So it is a very situational thing. I cannot say in black and white very clearly about it, because it is all according to the state government's rules and regulations which were prevailing at that particular point of time.
suppose in anaphylaxis shock, patient expired in the OPD. What is the difference for the doctor?
Sorry, in what?
Suppose the patient has developed the anaphylaxis shock due to injection or medicine and the patient expired. And
Yes.
what is the difference for the doctor?
So again, the same thing goes, like I said earlier. If you are able to prove it with the help of your medical literatures, with the help of your medical qualification, with the help of the medical protocol, standard of protocols which are there, SOPs of medical procedure, that whatever you have administered, the injection is the right injection according to and this is the injection only which is being injected or administered to the patient, to such patients, then yes, they cannot be medical. And at the same time, you are able to prove that the injury that has the reaction that injection has caused is something which is already documented in the medical literature, and you have also informed to the patient, you have also taken the informed consent from the patient about the same, then yes, you can be saved from it.
There's another question on allergies, where a lot of people do have an allergies on certain medicines and a certain salt of the medicine. If sometimes like it is missed out by a doctor, like if there is a change in the doctor, or there's a change in the treating doctor, and if it is missed out or if it is not, how is that being treated as a medical negligence? And even if it is or it is not disclosed by so if it's not disclosed by the patient, then obviously it is not a medical negligence. But if it is disclosed, but if it is missed out in the papers, then how it works out?
So if it is disclosed by the patient and it has been mentioned in the documents clearly, and the patient has also signed it, every hospital and every doctor, before going ahead with the medical treatment, before going ahead prescribing any medicine, they always ask the patient about the allergies of any kind of drugs they have. If the patient does not disclose the same, then doctor or the hospital cannot be held liable for the same, because that is the negligence on the part of the patient and not the doctor.
They cannot be forced to do the allergy test.
No doctor can be forced. In case of emergencies, you can't go ahead with the allergy test first and then you decide about the treatment protocol. That takes a lot of time then. What is important for the doctor is to stabilize the patient, is to save the patient first. That is the first and foremost thing for him. So in that situation, yes, doctor cannot be held liable to it. But if the patient has informed, if the patient has written, many hospitals, they ask the patient to fill the allergy form and specifically mention about it. If that has been done and still the doctor has ignored it or the nurse has ignored it, and they have given medicine of that particular drug of which the patient is allergic, then yes, he can be held liable for it.
Compensation to be according to the fees charged. Dr. D.D. Arora is asking this question.
What he is saying is right, but unfortunately, the Honorable Supreme Court of India has come out with the compensation formula. So nowadays, the compensation is given according to that formula. So I will not say it is according to the fees which is being charged, but it is according to the formula which has been there now. So that compensation formula is, I agree, little on a higher side according to the fees that the doctors charges for the treatment. But because it is the law now, so we can't do anything about it.
At least we can protest.
Yes, sir, we can protest, but then by one doctor's claiming or one person saying will not help it. That the whole fraternity has to come forward and try to get it done.
At the time of fees, they say they are very poor. And while taking the compensation, they calculate according to the standard of the person income.
Exactly. That's what I'm saying, because that's the formula the government court has come out with.
And I think all the professionals to be covered by this law, because negligence is in every profession, and moreover, other professions have more casualty, more loss to the nation. Rather, doctor deal with the individual person, while other professionals like engineers and the calamity and this loss is too much, multifold. And if a politician do it, then affects the country more, rather than while doctor affect only one person. So this is all.
So that's something which is a debatable issue,
Yes,
which obviously I cannot address on this forum right now.
And one point, compensation to be taken from all the beneficiaries, not only from the doctors.
For that situation only, just before you, Dr. Kiran, I told Dr. Kiran to add the hospital also, because actually the beneficiary then is the hospital only.
I know, but practically it's very tough.
But then it is a situation between the hospital. If you add the hospital, then she's also right. The doctor might lose his job. And if you don't add the hospital, then there is a situation where the whole compensation liability comes on the doctor, individual doctor, when he's actually got a consultation fees of only 10,000 rupees and he has to pay 10 lakh rupees. That's something which is a problem. But if you don't make the hospital party to it, then you have to bear the whole expenses.
Yeah, no, I think what the point over here is, when the case is filed on an individual doctor and is a part of a hospital where the fees has been collected by two beneficiaries, which is one is a hospital and the other is a patient. So automatically all the cases should make the hospital as a party without even putting in a form.
That can happen only if the doctor also come forward and give his consent for the same.
Yeah, but not automatically. Yeah.
Not automatically.
Because ultimately the beneficiary of the money which has been earned is not only the doctor,
that I totally
is a very
agree.
small portion, but the hospital, which is a major portion.
That is what is actually happening. So just to safeguard yourself, and there is a question I can see, if is there any insurance to manage such issues? So to answer these two questions, it is very simple, that every doctor should have a professional indemnity insurance.
Insurance, right?
And whenever you have a case against you, and just to give you a very important thing, don't take one professional indemnity insurance, take two professional indemnity insurance, one of a higher amount, one of a lower amount, but of the same company, so that if a case is filed against you, you give the details of your professional indemnity insurance of a smaller amount and make the insurance company party to your case. So if tomorrow what happens is, for example, you have taken an professional indemnity insurance of 10 lakh rupees, one amount is of 10 lakh and the other amount is of 50 lakh. You just mention about your 10 lakh, and then if instead of 10 lakh, the compensation amount is 30 lakhs, then you can add your other professional indemnity insurance also to cover it up.
But what's the benefit and what's the difference?
The benefit is there are two folds. One benefit is if you show if there is a higher amount.
Oh, they claim the higher one. Okay.
So you will claim the higher amount.
This is a jugadu way of doing it. I think this is okay. That's a good one.
And secondly, if unfortunately the higher claim is actually being awarded against you, you already have one higher amount in indemnity insurance, which is saving you.
So I would say it's like the patient will say, "Iske paisa hi nahi to dega ke hospital ko claim."
Exactly.
Okay. But you have a backup for yourself. Okay. That's a good way. I don't know if how many will agree, but I think this is a very good a take-home thing.
And a point, a conversation between the patient to be written, nothing oral, either recorded or to be read, because later on the patient may deny. We don't have any say.
Yeah, but how much records will you keep? That's too difficult.
No, medical records have to be kept. That's
No,
the
in
important
terms of
thing.
the verbal conversation, not the written records.
Huh.
And suppose tomorrow the patient deny them.
No, so that's why I before if you remember, I just told whenever you are taking any medical record from any patient and you take signatures from him, don't take just the signatures, take his thumb impression also. He can deny his signatures, but he will not be able to deny his thumb impressions. Thumb impressions will be of his only. You cannot force thumb impressions. और थंब इम्प्रेशन तभी आएगा जब पेशेंट आपके सामने होगा. आप अपने आप से
signatures can be also done at home or anywhere else.
हाँ.
Thumb impressions are like that. Okay.
Sometimes patients are instigated by the even lawyers, have the vested interest, though the patient was satisfied, but later on somebody instigated him and they again sue the court case against the doctors. What to do?
तो उस सिचुएशन में तो आप कुछ नहीं कर सकते. You can't do anything about it.
But if somebody has to really screw you up, I think they have a lot of things to do it.
Many a times, to be honest, sir, what you have said is right. I don't deny to it. This is also happening. At the same time, many a times I've seen patient goes to and take a second opinion from any doctor, और वो doctors ही अपने doctors के against बोल रहे होते हैं.
Yes.
So you can't even stop that also.
Physical and mental fatigue in doctors and paramedical staff because of prolonged working hours or because of lack of sleep results in errors.
Correct, sir.
There are no fixed duty hours for doctors. The doctors have been fighting for it in the entire world. What does the law have to say about it?
So fixed duty hours की बात कर रहे हैं. So there, when I started working with Dr. Agrawal, we did one research. And we got I now unfortunately he's somewhere else, so I don't have a copy of that. So after getting research and after filing RTIs, we got an answer from Ministry of Finance saying that every doctor, especially in the government hospital, is supposed to spend minimum 4 minutes with the patient.
4 minutes में क्या क्या कर ले?
Exactly. That's what we fought when he was in IMA. We fought on this issue also. And 4 minutes mein, and they say in 4 minutes you need to know the name of the patient. You need to tell about yourself to the patient. If he's a new patient, tell him about his about your qualification, your expertise, understand his family history, understand his problem, administer him the medicine, tell him about the treatment protocol. So they say in 4 minutes you do everything, and every doctor, then there will not be any problem. So this is what is there. But I agree there is a problem. And we are also in Heartcare, we are also fighting on this issue. We have already filed a PIL before Honorable Supreme Court of India on the issue of infrastructure. And it is pending. Unfortunately, because of COVID, the petition is pending only. It has not come out. But yes, I am hopeful that something will come out of it, and whatever we'll be able to do, we will do till the end.
Is the law sympathetic to the doctors or the paramedical staff on this issue?
Yes. See, law is something says that if they, for example, like you remember what happened in Kota, Rajasthan, with the infants. If you remember, last year it happened.
Mm-hmm.
So that was something which obviously nobody will accept it, because you can see lack of oxygen cylinders. What happened in second wave also, lack of oxygen, it was visible. So something which is visible, and you know that there is a lag, there is a lot of lack in supply, there is a lot of demand of it, the patient requires it, and you are not still doing it, then yes, you can be held liable for it. Because you cannot ignore everything, and you cannot say कि हम एकदम से pandemic आ गया, एकदम से surge आ गया, तो हम कुछ नहीं कर पाए.
ये तो deficiency of service है ना?
हाँ, ये deficiency of service है.
It's not negligence.
No, this is not. This is all relating to the
doctor has done his or her part and convey to the administration that this is what is expected. And if
Correct.
it does not materialize, it is deficiency.
It's a deficiency of service, and it's not about private or government hospital. It's about the hospital as such. Infrastructure, there is a lack of infrastructure. I agree to it. And we are fighting for that lack of infrastructure. So let's see how it goes ahead.
May I request you to fight for the fixed duty hours for doctors, as it is in all professions, so that they can give their best. In some countries, suppose a doctor is operating and the surgery goes on for 8 hours, the doctor and the team is relieved by the reserve team. In our country, one continues, and because of that, because of fatigue, there are errors. And
I agree. I remember one of the doctor, his WhatsApp status was, "I'm also a human being. Now it is my family time. Please let me have my family time." It's his WhatsApp status.
So I think we are running out of time. We'll take some quick one more question. And one question is, where if in case of emergency, there is an accident or there is some kind of a emergency, even if it's not an accident, if it's like just any pain or something which is not a heart pain or something, but the person cannot afford and he goes to the nearest hospital, they do give an emergency treatment, try to make it stable, and then ask them to go another, and there is a death in the during that, once it relieves and once it's going out to another hospital, finding another hospital or government hospital, is the hospital can be in terms of medical negligence, because the patient could have survived if the money aspect was not there, and he would have been in the hospital for some more time, but just because the hospital did their duty to make the patient stable in terms of the first aid, but did not do the further testing and let the patient go.
So like I said earlier also, in case of emergency, if you are able to prove that yes, whatever treatment protocol you have followed is according to the medical protocol, so then yes, you cannot be held liable. So whatever you do according, there are only 2-3 takeaways I will say. 1, doctor should perform his treatment according to his reasonable degree of skill, his expertise, his qualification. 3, he should perform treatment according to the medical protocols which are being widely accepted, which are being widely performed. 3, he should know and he should be able to prove whatever treatment he has given to the patient is according to his skill, is according to the medical protocol only. 4, the doctor should take informed consent. They should be informed communication in consent form or in any kind of paper medical record. Take not just the signatures, take the thumb impressions also. And 5th is most important, take a professional indemnity insurance. Take at least 2 professional indemnity.
If you want, we can have a session on the insurance, indemnity insurance, and I can bring an expert also. And we can also cover some financial aspects as well later on. We'll talk to Dr. Nidhi and Dr. Meenakshi for that. Anything else quickly? Otherwise, we'll wrap up the session.
The answer of the
Very
question.
important question.
I'll first ask Astha Medical.
Yeah.
Yeah.
The question to your answer to your question that the person dies in between and is being referred to a different hospital because of unaffordability. I think what you, sir, used to say that the doctor should accompany the patient till he is.
But that I don't think is possible in this era where doctors are very busy. I think that's unreasonable to ask, but yes, that should be the practice, I'm sure.
Yeah, that's what I have to say.
When somebody is not treating the patient because of the financial aspect, I'm sure that they will not be having a time to take the patient to the another hospital also, especially when the patient is poor. Unfortunately, in this country, we don't treat poor patients at that thing in terms of the hospital, not in terms of the doctors. But yeah,
this is what I have.
Can we refuse? Can we refuse the patient if there is a call in emergency?
Yes.
Yes, you can refuse. Yes, you can refuse the patient. Or
I'm not available.
Yes, you can refuse. It is not. It's not situation that it's the patient's right to have it that, or it's your fundamental duty only to give a treatment to the patient. You can choose your patient also.
Any other question we'll take? Otherwise,
What is the liability of the referring doctor?
That is a subjective thing. That will be a situational thing. If the referring doctor's reliability does not lie because he has only referred, but if there is something which the referring doctor was supposed to tell the treating doctor and he has not informed the treating doctor, then yes, he can be held liable for something.
yeah, absolutely. Okay, so I think this is an interesting topic. We would need some more sessions on it. With this note, we would love to close this session, and we would come forward for more question answers in the future sessions. We will have some more sessions going forward. Do let us know your feedback. We will be love to add those feedbacks and take those topics in our comments in our future sessions. With this note, I would like to thank everyone, the participants, the audience, everyone, and the speaker. Thank you for joining this session. See you again next week, same time, same day.
Thank you.